Hello all, I am Dr. Hena Dhingra Consultant, Obstetrics and Gynecology and Laparoscopic Surgeon at Sohana Hospital. So today we'll be talking on breast cancer. Breast cancer is the most common cancer in females worldwide. It usually presents as a painless lump, and since it presents as a painless lump, that is why it goes unnoticed and women tend to ignore it because they think because it is not causing any problem to them, it is not causing any interference in their day-to-day activities, so they do not seek any medical help, and that is when the stage of breast cancer increases and their complications that increase. If we talk about the risk factors for breast cancer, aging is a natural risk factor. As the age increases, the chances of getting breast cancer increases. So if we look at the incidence, if a woman is between 25 to 30 years, her incidence would be 1 in 2500 women of having breast cancer. As the age increases, like if you reach up to 50 years, 1 in 50 women, they have a chance of getting breast cancer. By the age of 80, almost like 1 in 8 women, they acquire breast cancer in their whole lifetime. So aging is a natural risk factor which we cannot avoid. The second risk factor for breast cancer is family history or your genes, which also you cannot change. There are so many genes which are responsible for breast cancer, of which BRCA1, BRCA2 genes are most important. And if there is any family history of uterine, ovarian, breast cancer in your first degree relative, like your mother, your sister, your chances of having breast cancer also increases. Third, which is a modifiable risk factor, is the lifestyle nowadays. Because of the urbanization, because of the lifestyle changes, because of the dietary changes, the sedentary lifestyle, the chances of having breast cancer, they increase tremendously. Now, if we look at the symptoms of breast cancer, first that I discussed was that it presents as a painless lump. Second, there may be some discharge from the nipple, there may be some skin thickening which may be there may be retraction of the nipples, it may just present as a rash around the nipple, there may be a swelling which may be present on the breast or around the breast or under your armpit, that is the axillary region. If you notice any such change, you should visit your doctor as soon as possible. Now we'll talk about the screening which can be done for breast cancer. The foremost thing or the most important thing that has to be done in prevention of breast cancer is the breast self-examination. Any woman or any girl who is above 20 years should know how to do a breast self-examination. It is very simple. You just have to stand in front of a mirror and examine both the breast, the shape and size of the breast, and just examine both the breast with your palm. Because once you know what is normal, then only you will know what is abnormal for you, and then only you will be able to pick up changes which are present in the breast. Usually, breast self-examination should be done 4 to 5 days after your periods are over. Second thing which is available for screening is the clinical breast examination. This examination is done by a medical professional. Every 3 years, any woman should visit a doctor for a clinical breast examination, because a medical health professional can detect or can pick up some changes which are difficult to be detected or which are difficult to be picked up by a common woman or a layman. Third, which is the gold standard, is the mammography. Mammography is nothing but it is just an X-ray of breast which should be done, or it is recommended above 40 to 45 years age group. Every year this should be done, and it can pick up even minute changes which are present in the breast. In patients who are at high risk of having breast cancer, like those who have any family history or because of some lifestyle changes, they are obese, so in them even mammography can be done earlier, even after 35 years of age group, if they have completed their family life. So as we discussed, prevention is always better than cure. So it is always wise to prevent the disease and to know it before it happens. And even if it is not possible, even if you acquire the disease, it is always better to diagnose it in early stages. So with this note, I would like to say that all the treatment facilities are available at Sohana Hospital under one roof, and in case of any difficulty you can contact us. Thank you.